everyone.
There should be one button.
All right. Should I put it on? Oh, it's on.
Hi. Good morning, Your Excellency. This is Zahid Malek, Health Minister of Bangladesh. Nice to see you.
Good morning, everyone. Am I audible?
You are loud and clear. And
Perfect.
also
Perfect.
visibly also excellent.
Thank you. Thank you. Good. Thanks to Dr. Poonam and her team.
Yes, they have done a good job. Please
Okay,
convey
good.
my all the best wishes and anticipating a successful session today.
Thank you. Thank you. Should we start, Michelle? Yeah. Yeah. Everybody is online, I'm assuming. Yeah. Good. Okay. Good morning, Excellencies, ladies and gentlemen. It is with great pleasure that I welcome you to the live forum for the candidate for the election of the next WHO Regional Director for Southeast Asia. The live forum for the candidate complements another feature of the election process, that is the password-protected web forum only accessible to the member states for question and answer with candidate that the Secretariat opened on the 4th of September 2023 and closed on the 1st of October 2023. The web forum will remain available to the member states in the read-only mode until the closure of the 154th session of the Executive Board. The live forum for the candidate has been convened following consultation of the members of the Southeast Asia region. This consultation, which opened on the 4th of September and ran until the 22nd of September, demonstrated majority support within the region for holding of such forum. As a result, the regional office proceeded with the practical arrangement of the live forum. Let me thank all of the support given to this initiative and to the Secretariat for its readiness in organizing it. As you know, this is a non-decision-making platform intended to provide an opportunity for candidates to present their experiences, expertise, and vision to enable member states to acquaint themselves with the candidate. Participation in this forum for the candidate is limited to the regional committee member states of the Southeast Asia region only, assisted by a limited number of the Secretariat staff. Please note that this forum for candidate is being webcast for public viewing on the regional office website, as well as live streamed on social media account, YouTube, Facebook, and X, previously known as Twitter. We kindly ask all of those in the room to have their phones off in order not to disrupt the conduct of the live forum. Let us turn to the arrangement for the interview. While the communication to the Secretariat on the 7th of October, the Secretariat circulated the arrangement for this meeting. Each candidate is to make a presentation up to 20 minutes, which will be followed by a question and answer session for an overall duration of 40 minutes. May I recall that detailed proposed arrangement for the interviews are as follows. Turning first to the initial oral presentation, the oral presentation by each candidate is not to exceed 20 minutes. While 20 minutes is allotted for the presentation, candidates may wish to make the presentation of less than 20 minutes in order to leave more room for question and answers. As far as the process for selecting question is concerned, each regional committee members joining the forum may ask question if so wishes. Regional committee members were invited to indicate the candidates they wish to ask question by writing to the regional office no later than the 16th of October at 1600 hours, New Delhi time. Tokens bearing the names of all the regional committee members who notified the Secretariat that they wish to ask question were put in the relevant receptacles, the one that you see in front of me, one for each candidate. Let us remind you that the member states that nominated a candidate are expected not to ask question to the candidate they nominated. After each candidate has made their oral presentation, I will put the token one by one on a random basis until the time available is exhausted. After each token is drawn, the corresponding regional committee member will be invited to ask the question and the candidate invited to provide the answers. As concerned, the procedure for the question and answer session, regional committee members will have up to 1 minute to ask one question only. Please do not divide questions into different parts as such that there is, in effect, more than one question. I would ask that the members whose lots have been drawn are therefore provided the opportunity to ask the question to kindly refrain from posing question to the candidate which seems identical and substantially similar to one already addressed to that candidate. I would also like to ask the member regional committee to please have their cameras on and to unmute when given the floor. Candidate will have up to 3 minutes to respond to each question. Each interviews will conclude when 40 minutes have lapses, even if there are still questions pending. However, a candidate will be permitted to complete their answers to the question being addressed when 40 minutes have lapsed. Should there still be time available after all the tokens have been drawn, I will open the floor for the regional committee members that have not yet asked the question to see whether they wish to do so. I will give the floor to the members in the order in which they raise their hand in the Zoom. If following this, there is still time available, the candidate may, if he or she wishes, make additional remarks within the remaining time. Regional committee members connected online and those of us in the room will see a clock on the screen indicating how much of the 40 minutes allotted per interview remains. There will also be a clock indicating how much of the 3 minutes limit for responding to each question remains. These will be used to help participants keep within the time limit. Because of these strict time limits, I ask all regional committee members not to interrupt the interview process by taking the floor unless this is on the matter dealing with the conduct of the interview. Please note that in my capacity as the moderator of this forum, I may ask you to conclude your questions and interventions in case it goes beyond the allocated time. Are there any questions? Do we see anybody? No.
No, thank you. Thank you.
Thank you.
We don't
I
have
see
any
none,
question.
then.
We got your all your points. Thank you.
Thank you. Thank you. I see none, so I therefore take it that there is an agreement to the proposed modalities. In line with other WHO meetings of this nature, I propose that the working hour commence at 11:30 New Delhi time. Is there agreement to proceed in this way? Yeah, I see no objection. We now need to decide in what order the interview should be held by drawing a lot. The order of the interview will be based on the order in which the names are drawn. I will now proceed with the draw of names from this green bag. Should I open it? Okay. Okay. Before I proceed with the name, please note that the member states and the candidate should refrain to one another with respect. Member state questions to the candidate should be in line with this. Questions of disrespectful or discriminatory nature should not be asked. The order of the interview shall be as follows. Ms. Saima Wazir, followed by Shambhu Prasad Acharya. So the first draw is Saima Wazir. Accordingly, the program of today's forum is as follows. The first interview will be that of Saima Wazir, followed by the interview of Shambhu Prasad Acharya. I now kindly ask Saima Wazir to prepare to take the floor. Thank you.
Thank you, Excellency. May I start?
I think so, yes. Yes, please.
Good morning, Your Excellencies, distinguished representatives from our member states, and my fellow nominee. I've been looking forward to today for this opportunity to tell you all about my experience, my vision for the public health of the Southeast Asia region, and my plan to transform this vision into a reality. I'd like to start by telling you a little bit about myself and the work I've done. The arc of my career encompasses being a health practitioner, a trainer and educator, as well as a public health specialist. I think this spectrum of experience is an important distinction because it gives me a holistic view from which I will approach this role. Over the past 22 years, I've worked on the critical issues of neurodevelopmental disorders, mental health, and disability. As you all know, neurodevelopmental disorders and mental health issues remain largely stigmatized in our societies. As an advocate, I have worked to mainstream these matters, to break down the attached taboos, and to start the extremely necessary journey towards normalizing these issues. As a technical expert, I've formulated public policy and advised national governments on developing legislative and technical frameworks. In that capacity, I am currently advisor to the WHO Director General of Mental Health and Autism, Chief Advisor to the Government of Bangladesh's National Mental Health Strategic Plan, Chairperson of Bangladesh's National Advisory Committee on Autism Spectrum Disorders and Neurodevelopmental Disorders, and was lead consultant on the National Strategic Plan on Neurodevelopmental Disorders for the Royal Government of Bhutan. Additionally, I also advocated for the passing of and provided a technical input in the following international resolutions. The WHO Zero Resolution in 2012 on comprehensive and coordinated efforts for the management of ASD and developmental disabilities. The UN resolution in 2013 on addressing the socioeconomic needs of individuals, families, and societies affected by ASD, developmental disorders, and associated disabilities. And the WHO resolution in 2014 on comprehensive and coordinated efforts for the management of ASD. As an educator, I have developed manuals and trained professionals, caregivers, and other stakeholders in Bangladesh, Kuwait, and Saudi Arabia. I'm also a faculty member at Barry University in the USA, where I'm also in the final stages of my doctorate. In the international arena, I've recently been appointed as the Global Center of Adaptation's Special Representative for Climate and Health. I'm a commissioner at Chatham House's Commission for Universal Health, a member of the WHO Expert Advisory Panel on Mental Health, and CVF's thematic ambassador for vulnerability. I'm also pleased to let you know that in 2014, I was recipient of the WHO Zero Award for Excellence in Public Health. My professional career started in school psychology as a licensed school psychologist in the US. I worked in underprivileged communities in Florida. That experience has shaped much of how I approach my work today. It taught me the importance of involving in the decision-making process the views of the very communities we are trying to assist. It showed me the best intentioned policies may not have the desired impact at the grassroots level. This is why my work is today characterized by multi-sectoral partnerships, by listening to grassroots communities and people with lived experiences. And crucially, instead of taking a bureaucratic and top-down approach, by rather taking a collaborative and ground-up approach. This approach is certainly more meticulous and time-consuming, but it leads to results, better results, and more durable outcomes. My vision for the Southeast Asia region is quite simply a region where people have access to quality healthcare regardless of where they live, their income, or their social status, and a region where people live longer, healthier lives than they do at present. Now, how do I propose we achieve this vision? By strengthening, enabling, and empowering. We must strengthen member states and WHO to address health gaps in the context of our region's current realities and challenges. We have to enable member states to devise and implement innovative local solutions for equitable healthcare. And most importantly, we must empower marginalized and vulnerable groups to ensure that no one is left behind. It is crucial to recognize that our region consists of enormous social, economic, and political diversity, both across and within our countries. The health priorities of our region are shaped by the unique health challenges faced by member countries. I'd like to talk about some of these public health challenges in our region. Infectious diseases. As you all know, many countries in our region face significant challenges related to infectious diseases, such as malaria, tuberculosis, dengue fever, and HIV/AIDS. If elected as regional director, ensuring access to prevention, testing, screening, and treatment will be a priority during my tenure. Non-communicable diseases like cardiovascular diseases, diabetes, and cancer are on the rise in our region and account for 71% of all deaths in the region. Prevention, early detection, and management of these diseases will be prioritized. The quality of maternal and child health services is a significant challenge in our region. I will work towards reducing maternal mortality rates, ensuring safe childbirth practices, and addressing malnutrition in children. Mental health issues are gaining recognition as a significant public health concern. And the COVID-19 pandemic has further highlighted the importance of addressing mental health. I will speak more about this shortly when addressing my priorities for the region. Given our region's vulnerability to natural disasters, preparedness and response to emergencies are crucial health priorities. This includes having robust healthcare infrastructures that can withstand disasters and respond effectively in an emergency. Immunization has been a challenge for some of our member states, and ensuring that populations are immunized against preventable diseases is a priority. This includes routine immunization, as well as specific vaccination campaigns to counter diseases like measles and polio and cervical cancer. In 2020, only 54% of the population in our region had access to essential health services. And so many countries in the region are now working on strengthening the healthcare systems. This includes improving infrastructure, training healthcare workers, ensuring access to essential medicines, and enhancing health financing mechanisms in order to ensure that we have a return on the investment. It's important to note that these priorities can vary from country to country based on their specific health challenges and demographic profiles. These current realities are not fixed and will change over time. Therefore, I will continuously seek feedback from member states on priorities and actions that the regional office should be taking to face the changing contexts and realities. The regional committee will be instrumental in providing such direction and guidance to the Office of the Regional Director. In line with some of the major public health challenges in our region, my priorities will include the following: accelerating universal health coverage, emergency response and pandemic preparedness, collaboration and partnerships, both regional and multi-sectoral, monitoring and progress reporting, marginalized and vulnerable groups, climate change, and of course, mental health. To accelerate universal health coverage, I will enable member states to implement equitable healthcare through effective and innovative local solutions. It is essential to monitor health inequalities, to identify and track disadvantaged populations, and to provide decision makers with evidence and data to formulate equity-oriented approaches. Regarding emergency response and pandemic preparedness, I will encourage countries in our region to engage all of society for effective pandemic preparedness and response. Particular attention will be given to multi-level planning, which will also be linked to health system strengthening. Another priority of mine is collaboration and partnerships, both regional and multi-sectoral. This is a very important element of my plan. If we are to achieve our ambitious goals, it will take the active involvement of different regulatory sectors in our health planning. This includes education, finance, social welfare, technology, and others. Also, I will champion facilitating inter-country learning opportunities and platforms, as well as inter-regional knowledge sharing. It is essential we each learn from each other's successes and failures, and in fact, from other regions as well. We have to recognize successes and adapt and localize them for implementation in other countries. In order to continuously improve our outcomes, it will be crucial to prioritize monitoring and progress reporting. We must strengthen mechanisms for measuring and reporting of progress made in implementing strategies and programs. This will improve our decision-making, and that can only benefit our public health outcomes. In order to truly ensure that no one is left behind, one of my focuses will be to empower marginalized and vulnerable groups. In order to do this, we must focus on strengthening health systems, both preventive and curative, to ensure coverage and equity. We must continue to provide member states and development partners with updated evidence, analysis, and recommendations related to inclusion of marginalized and vulnerable groups in the health sector and beyond. We must prioritize the unavoidable crisis that is affecting us all increasingly all over the world, which is climate change. We have to continue to promote mechanisms for raising capacity for effective climate change-related planning and management. We must prioritize health sector resilience to climate and environmental change in all strategies and action plans, as it is becoming very clear every single day that climate change is having an impact on every aspect of our lives. Finally, a major health issue for our region, and in fact for the world, is an issue that I hold close to my heart, that of mental health. In order to increase access, we must work towards promoting community-based mental health care services. We also have to ensure structuring healthcare systems to encourage intervention at all stages of evolution of mental health issues, with a focus on prevention. I will also increase coordination with other global movements, such as sustainable development, chronic diseases, human rights, and climate change, in order to address the issue in a holistic way. I'd like to now tell you about my priority program, which focuses on women, children, and then gender diverse individuals. During my years of experience, I've realized the most important of accelerating the progress of women and children cannot be ignored. Mounting evidence shows the importance of focusing on women has manifold, multi-generational impacts on public health. Improvements in early childhood development, and even the creation of more equitable and peaceful societies. Aside from being a majority of the population, women are also societally the heads of our households. Their knowledge, understanding, and practices regarding their own health are spread not only amongst their own families, but in their broader communities as well. We also know that the health outcomes of the next generation are impacted even before they're born. And so we must pay a particular focus to the physical and mental health of pregnant women. Better informed mothers provide better nutrition for children. They encourage active lifestyles and other healthy habits. They instill the need for cleanliness and hygiene. All of these lead to lifelong and multi-generational benefits. Unfortunately, it is also true that mothers are historically often least likely to look for health care for themselves. They put themselves last. We need to change this. We know that women act as volunteers in their communities, assisting others with their own skills and knowledge. When you teach one woman, she will teach other women around her. Quite simply, improving the health and knowledge of a woman makes the overall population healthier. Additionally, the SDGs framework recognizes the essential role of gender equality and empowerment in enhancing women's lives and strengthening families and communities. This extends broadly to advancing overall social and economic development. How can we accelerate the progress of women and children? Firstly, we must strengthen our primary healthcare systems to deliver essential interventions to this population group. We must focus on improving multi-sectoral collaboration so that services are better integrated and reach every woman and every child. We must invest in their empowerment and bolster leadership opportunities. And I will work towards private-public partnerships to improve funding and services for this group. Across all member states, I will work with a life force approach to ensure that all health-related issues are incorporated in planning and service provision, and ensuring that empowerment and prevention is at the center of it all. In order to achieve universal health coverage within our region, it is of the utmost importance to utilize digital health technology and to create a platform for exchange of knowledge and resources. Also, a multi-sectoral approach will ensure the best outcomes for all our member states. And we must not forget to monitor our progress through continuous data generation and research. Accurate data will enable us to restructure our existing initiatives and programs and shift our region's resources to accelerate impact within our member states. Given our region's diverse public health challenges, it is safe to say that the path ahead is not a simple one. I believe that we must work together with a problem-driven approach based on case studies, research, and most importantly, on-ground feedback. And as we all know, political will and support is at the heart of it all. And I will work closely with the member states to ensure this. At the start, I mentioned my belief in stronger and more durable solutions coming through collaborations and partnerships. Much of what I have proposed and spoken about will be better implemented through strong partnerships and through collaboration with other entities. In the use of technology for healthcare services, we can partner with ICT ministries and private sector tech companies. On the crucial issue of climate change related impacts on health, we will have to engage with our environment ministries and the many development organizations working in this space. For the training of our healthcare workforce and for educating our people in our better health practices, we can partner with our education ministries and private education providers. On matters of nutrition, our ministers of agriculture or food would be our natural collaborators. And further down the line, if and when we tackle an issue like health insurance for our people, it will be our ministries of finance with whom we partner. As we all know, change is the only constant. I believe that the WHO should continue to become more agile and adaptable, and we should continue to innovate to face future challenges. As I said before, improving the health of populations requires addressing many determinants that lie within the health sector, but also beyond the health sector, and it is imperative to address this. If elected as regional director, I will continue to learn from each of our member states so that I'm able to address the individual needs of each country. I truly believe that there is no one-size-fits-all solution. It is with our local and regional understanding that the office of the regional director will better understand and respond to your challenges. I feel I'm best placed to take on this important responsibility. I have both policy and implementation experience, and it will take a synchronization of both to get the results we all want. We're always stronger together, and I look forward to building a health alliance with you and amongst you for our shared future as we work together towards building a more resilient Southeast Asia region. Thank you.
Thank you, Saima. We will now continue the interview with question and answer. I will now pull the first token with the name of the regional committee member which expressed their wish to ask a question to Saima. I shall now give the floor to Maldives to ask their question.
Thank you, Madam Chair. Is my voice clear?
Yes, you are audible. Thank you.
Thank you, Madam Chair. If elected as Regional Director of Southeast Asia region, what would be the main strategies that you would embark in this region to bring about operational effectiveness at WHO country offices and in WHO's work, both at regional and country level? Thank you.
Thank you for your question.
Thank you. Sorry, I have to say. Thank you, Saima. You now have the floor. Please ensure that you complete your answer within 3 minutes. Thank you.
Thank you for your question. I appreciate the challenge that we always face because of the many diverse needs and locations of our countries. In order to ensure better collaboration and cooperation, I think it's very important to set up a system where we have better communication. Using a robust digital platform would also increase and improve this cooperation and collaboration and make communication much more effective. There seems to be overall a lot of success that we've had. I've met with many of you, and the knowledge that is there within each of our countries. What I would like to do is set up individual committees so that health ministries, as well as the WHO offices that exist in the countries, have a better collaborative relationship. And that information reaches the regional director's office much more effectively. So overall, using a combination of better communication, using digital platforms so that data is reached to the necessary groups within a short period of time is the only way to really improve on some of the challenges we face in this cooperation and the diversity within our region. I know that many of our countries do not have these platforms. Some of us do, and we found it to be very effective. And in order to assist in expanding the service, we are going to have to find a way to ensure that there is sharing of resources, sharing of knowledge, and support for one another, so that each, from the local to the regional and all the way to the headquarter offices, there is greater communication and much more timely response to our needs. Thank you.
Thank you for that answer. Now I will draw the second question, member states. May I now give the floor to Nepal? Can you please unmute your mic? Thank you.
Thank you for giving me an opportunity to ask the questions. Member states have emphasized in the past governing bodies meetings for WHO to strengthen country support for better results in countries. How could you ensure better country support as the next regional director of WHO Southeast Asia region?
Thank you. Saima, you now have the floor.
Thank you. I think country support, WHO offices are there, but oftentimes we within our country offices do not have the necessary experts that are accessible. We do not have the necessary personnel, and sometimes there is greater challenge in how the WHO country offices and the ministries and the focal persons communicate. Again, I think it's sort of a similar answer, because creating an environment of better communication and collaboration is the key, and that can only happen if there is more frequent dialogue. And if our goals are identified, by strengthening the country office roles to be supportive of your ministry is the only way that we can improve the way WHO is supporting countries. I know this is exactly what we faced during the COVID-19 pandemic when we were in Bangladesh. We have very expert information, we have a lot of expertise within WHO, but by the time that information comes to our country, it isn't always reflective of the exact situation. The solutions aren't always reflective of what it needs to be done. So we have to translate very technical information and localize this so that for the next emergency, next pandemic, next health challenge that comes our way, we are already prepared. This can be done by ensuring that our health infrastructures are improved. So ensuring that the WHO office provides all of the support that countries need to have a health infrastructure that is robust, is reflective of the challenges that the health ministry and the people need. That is the only way that countries will get more support from WHO. And again, nowadays we do have the technology, we have e-health systems, we have digital platforms. By creating a platform from the WHO regional office that is utilized on a regular basis from the country offices, this would help improve how we are engaging with each member country, how we are providing the support and ensuring the technical know-how and expertise is provided. We're very fortunate in this current era that we have such technology, but within our countries, all of those resources still do not exist. And so, making sure that the latest technology, the latest system, the most up-to-date methods are made available and implemented within each country office in order to support the ministries and member states is what I hope to do.
Oh, thank you. Thank you. I will now draw the third question, third member states. May I now give the floor to Indonesia?
Thank you, Minister Dato' Mangmo. Good to see you again. As outlined in Minister's letters to Dr. Poonam and CC to the WHO member states, Indonesia supports the effort of WHO in enhancing the transparency and accountability of the WHO Southeast Asia Regional Director elections process. The holding of today's live forum, in which both candidates coming to be interviewed, provide us and wider participants opportunity to assess each candidate's suitability. I thank Ms. Saima for the presentations. My question is, could you elaborate more on your strategies to enhance country participations in WHO and FQ level, as well as project, and to ensure their alignments with respective national and global priorities. I thank you.
Thank you. May I now give the floor to Saima?
Thank you. I'm sorry, I'm having a little, I wasn't completely clear on the question.
If I may repeat.
Yeah, it's just, I think the mic is echoing a little bit. I'm sorry.
Yeah.
May I
Could you
request
elaborate more?
Indonesia to repeat the question?
Could you elaborate more on your strategies to enhance country participations in WHO CR and HQ level as well as project, and to ensure their alignments with respective national and global priorities? Thank you.
Thank you. So I truly believe the best way to ensure that there is greater alignment between the country's strategies and the country's needs is to have more regular and more effective communication. Again, it kind of comes back to engaging in greater dialogue, engaging in partnerships. What I would do as regional director is what I have done in the past, is actually sit down with you, create sort of not just one designated person, but a committee of people, so that there is alignment. We do have global goals, we have diseases we've identified. WHO has a lot of strategies and plans in order to achieve it. But sometimes in our countries, we don't have the necessary resources, or those same diseases are not necessarily what is the highest priority, or we cannot achieve that particular goal without taking care of other health needs. So having in the first year, in the first few months, is sitting down and looking at what it is that your country needs and creating a necessary team that would work together on solutions, on identified goals, and look at what existing plans and strategies and programs exist within WHO and what else is needed. So, for example, when we look at the mental health strategic plan, we understand it's a very robust MHGAP plan. It's very detailed. It's very thorough. However, when it comes to the reality in our countries, certain gaps exist. Certain resource persons don't exist. Certain resources don't exist. The same programs cannot be implemented. So when we look at what your priorities are and what WHO's overall member country goals are, we can sit together and see how well we will achieve it. And this strategic plan that we work on together would also then incorporate other development partners, other resources that might exist. So creating a partnership that already is there in each of your countries, but also looking at it regionally. Can other countries help build up this resource that doesn't exist? Can better partnerships exist to build up this resource that's necessary? So it has to really be a two-way communication and sitting down together, having these robust dialogues and discussions that are
Sorry,
much more—
Saima, may I request you to wrap it up, please? Thank you.
Yes. And I think that's the way to best align our strategies and ensure greater country participation. Thank you.
Thank you. I will now draw the next member state. Second last. May I now request Thailand to—
Thank you, Chair. Thailand would like to learn what and how the candidate will maximize use of WHO CCS country cooperation strategy for benefit of the whole region the whole region, not each individual country. Thank you ค่ะ
Saima, you now have the floor.
I'm sorry, was it WHO CCA? I wanted some clarity. The question.
WHO CCS Country Cooperation Strategy.
Okay, country cooperation strategies. So, using each country's cooperation strategy, I think every country within our region, some countries have further their infrastructure, have much more robust health, primary health care systems. Some have really good community care systems. Others have specialized centers and tertiary care systems. So the best way to ensure that our country cooperation plans work for our region is to see how we can emulate what has worked within one country and how that can reflect and better answer the needs within another country. Again, we are 11 countries, and although our needs are very diverse, they're also very similar in many ways, and we can take learned experience. Not everything always makes it into robust data, but when we look at in-ground methods, we can then utilize that information and develop regional plans that are much more effective. So for example, in Bangladesh, we have a national strategic plan for mental health. We have a national strategic plan for neurodevelopmental disorders, which is much more comprehensive and robust and incorporates 16 ministries. Other countries might not have something that's as comprehensive. So we can then utilize a plan such as that and help implement it and ensure that other countries develop similar plans. So that's one of sort of a short, sweet example that I can give that can ensure that we have greater cooperation. Thank you.
Thank you. Now I will draw the last member state. May I now give the floor to DPR Korea?
Thank you, Madam. Ms. Saima, was it? One question, during online forum, you pointed out the need from the COVID-19 pandemic lessons to encourage countries in the region to collaborate and exchange knowledge on vaccine manufacturing, vaccine research, and accessibility of vaccines at low costs. Could you please share with us some specific vision or possible incentives for that in the perspective of WHO CR office? Thank you.
I think WHO CR office is in a very good position and can enable greater cooperation between our countries. So within our countries, we may have a lot of differences in how we engage with one another. We may have a lot of challenges that we may face with regulations and procedures. WHO regional office can play that important role in ensuring that vaccine production within one country is then able to cross and remove many of those barriers. We, as regional office, can play, we essentially play an expert role. We play a neutral role. I think in enabling that, the challenges we face because of our political diversity, political borders, as the regional office, this, ensuring that both the vaccines are, being produced as well as supplied. We faced many of these challenges during the pandemic. I know that our Prime Minister was very proactive and supportive, had the foresight to plan very early on in order to get the necessary supplies that she anticipated. Other countries may not have been in that same position, both financially or otherwise. And so we cannot always rely on our political leaders to always be able to have the same foresight or have the same resources, have the same planning. WHO regional office could provide that buffer. They could be that caveat, but can also play an important role in helping advise and guide member countries in making that planning. So again, taking learned experiences on what worked and did not work is, that's research data. That is extremely important research data. And that is what we can use in order to ensure that vaccine availability for situations, particularly challenging situations like the pandemic, are addressed effectively.
Thank you. We have now exhausted all the questions for Saima. As you can see, this is empty. The total time for this interview has been exhausted. Thank you very much, Saima, for being with us today.
Thank you so much. It has been a pleasure.
We will proceed with the interview of Shambhu Prasad Acharya. Please proceed with your oral presentation of up to 20 minutes. You now have the floor.
Thank you. Can you hear me, please? Yes? Okay, thank you. Honorable Regional Committee Chair, distinguished member states delegates and colleagues, thank you so much for this opportunity to speak to you today. I stand before you in all humility to present my candidature for Regional Director of WHO Southeast Asia region. I say humility because the task before us is huge, but also hugely important. When we think of the billions of people in our region, a quarter of the world, we know that each one of them is aspiring to attain the highest possible state of health and well-being. It is only with humility that we can serve the people and help them to meet their aspirations. I know from my personal journey the importance of that aspiration for health and well-being. My journey started in a farming family in the rural part in Western Nepal. Where I grew up, there were no roads, electricity, health centers, or proper water and sanitation. When a family member got sick, I would pray and hope for the best because there were no doctors or medicines nearby. Because of my upbringing, I developed a passion to improve health, not just for myself, but for everyone everywhere, especially those in rural and underserved villages, like the one where I grew up and the one where I started my journey in public health. When I started my career in rural Nepal, I worked with communities who had very limited facilities or services, but did have the determination to work together in finding solutions and building well-being together. With my advanced degree in public health, that same spirit of determination and common purpose has continued to guide me through public health journey. And it has been the grounding of my work in WHO, in country offices, in regional offices, and in WHO headquarters. I have given detail about my personal background as a CG. I don't want to go into details, but I have represented WHO in very high-level political committees in the United Nations system, outside, and also I've served as the board of governors of the United Nations System Staff College. I loved, and I still love, interacting with individuals at the community level and policymakers. And as Director of Country Strategy and Support, I have reached the places where the true impact is made. I have a vision for the region. As the next regional director of WHO Southeast Asia region, I would strive for a healthier, safer, and fairer region, and one that can contribute to the health and well-being around the world. I have enormous optimism about our region. We have all the ingredients to make great strides in improving the health and well-being of the people. Our populations are young and dynamic, bursting with energy and ideas, with economic development, technological advancement, and rules in affordable generic medicines and vaccines and genetic produce at large. Our region can substantially contribute to achieving the health-related SDGs. And we have incredible strength that comes from diversity, rich culture, and traditions. My job as regional director will be to work together with you, member states, to ensure that each country, big or small, or at any stage of development, is given equal opportunity and provided with support according to their needs to improve the health and well-being of their people. And here is how I would like to do that. Aligned with the WHO's global priorities and the SDGs, which are very critical, I will anchor the Southeast Asia Regional Office's efforts in 5 key areas and be accountable as a regional director for delivering those results in each. These 5 priorities are population health approaches that tackle the root causes of ill health, universal health coverage based on resilient health systems, pandemic prevention, preparedness and response, science and innovation, and One WHO. First is the population health. We need to see a fundamental shift to health promotion and education in the region. Achieving this shift will require broad engagement across all of government and society to address socioeconomic, environmental, and commercial determinants through legislative, social, and cultural transformation. In my view, it is not just health education, it is education for health, as we build a social movement where everyone, civil society, youths, women, academia, students, and others, plays their role in contributing to a healthier population, but they must be given opportunities and supported to play their unique parts. Population health means tackling big issues. Climate change, for example, is not just the issue of environment. Climate change is among the greatest threats to health. I will work with countries to ensure that public health-friendly climate and environmental challenges take center stage in health strategies. There are many opportunities for WHO to collaborate with partners working in this space and to tap additional resources, including from the Green Climate Fund and other mechanisms. To tackle nutrition and unhealthy diet, I plan to publish the region's first ever report on commercial determinants of health, so that CIRO can better support member states to draw on the private sector as a force for innovation, but in a framework that reduces the burden of diseases without weighing to harmful products and commercial practices. My second priority will entail accelerating universal health coverage through resilient health systems. COVID-19 pandemic demonstrated that no country's health system was robust enough to respond to shocks like the pandemic. The lessons are very clear. We need resilient health systems to achieve universal coverage with a strong foundation in primary health care. Primary health care can provide 90% of basic health services. It is therefore the foundation of USC. We know in our region and globally, still half of the world population doesn't have access to basic health services. The recent political declaration on USC at the UN General Assembly reaffirmed the commitment of world leaders to take bold actions toward attaining the universal coverage target of the SDG by 2030. As regional director, I will work relentlessly with member states to translate those commitments to action for people by building sustainable, resilient health system with a strong, high-quality primary health care, which can provide comprehensive health services for all in the region. During the post-pandemic era, many countries are facing economic challenges, particularly financing the health sector. When governments cannot provide, then the burden falls on people, with devastating impacts on particularly the poorest people. This region faces the highest level of out-of-pocket health spending. I will work with member states to advocate for increased domestic financing for health, funding from international community to fill the gap, particularly for primary healthcare, and I will also support the member states in the identification of efficiencies in the use of financing in the health sector. I will work to support the production, distribution, retention, and protection of high quality health workforce in the region. The region is one of the global powerhouse in training health workers, but we know there is a growing global deficit of 18 million health workers worldwide. A trained, quality, safe, valued health workforce is the absolute essential of improved health. I will boost our collaboration with member states in delivering intensified health work strategies to address this challenge. While the region has made progress against communicable diseases, some diseases are still prevalent, such as TB, malaria, dengue, leprosy, and others. I will support member states in seizing the opportunity to eliminate these communicable diseases. Our region has about 45% of global TB cases. We are key to meeting global targets to stop TB. It will need enhanced community outreach, especially to the hardest to reach, poorest, and most marginalized. The goal of elimination requires covering the last mile, deploying point of care technologies, and access to life-saving medicines where the burden of these diseases remains the highest. NCDs, especially burdens of hypertension, diabetes, mental health disorders, and cancers are rising in the region. Although the region has made some progress to increase early screening and treatment for NCDs, there is more to do, and I'll work with member states to integrate primary prevention and treatment of NCDs treatment at the primary healthcare level. Maternal and child deaths are plateauing in the region, as we know. So we need to learn and apply lessons on how to bring them down. My agenda will include supporting efforts to improve sexual and reproductive health rights and malnutrition among mothers, adolescents, and children across the region. I will make gender analysis central to our strategies so that we can better support and to the targeted population. Prepare for, protect from, and respond to the future emergencies and pandemic constitutes my third priority. Based on lessons learned from the pandemic, member states are under negotiation towards a pandemic accord aimed at ensuring enhanced prevention, preparedness capacity, and effective response. It is good to see for an accord based on principles of solidarity, equity, and sharing of technical know-how among countries. I'm grateful that our region has been co-leading the work towards successful agreement on an ambitious accord. Recent UNGA declaration on pandemic prevention, preparedness, and response emphasized the importance of building national capacity and additional resources for preventing future pandemics. I will collaborate with partners to ensure countries are well-resourced and national capacities are boosted. What else we learned from COVID-19? It is this. Timing is of the essence. I will pursue a 7-1-7 target approach. Detect suspected outbreaks within 7 days, notify and start investigation within 1 day, and start the response within 7 days. I will work closely with member states to establish a regional rapid health response team as part of global team that can be deployed within 48 hours of a request from a member state. I will collaborate with member states to develop a regional blueprint for addressing novel pathogens at every step, from surveillance and early warning to product development and access, and making sure we implement a One Health approach to the threat of AMR, food safety, and zoonosis. I will support national institutions in designing and implementing national action plans covering policies, legislations, surveillance, public awareness, and research in which multiple sectors work together to address these challenges. Fourth is science and innovation. As a region, we power the world's digital innovation. This region is one of the pioneers in science, digital innovation, and technological advancement. And there are major benefits to harness it to the cause of health equity and solidarity. I will leverage opportunities in this space, building on the recent G20 declaration to improve health services and technologies. I promise to work with member states to foster cooperation and collaboration and sharing experiences and technical know-how to ensure access to affordable medicines and vaccines as a matter of solidarity, including through South-South cooperation. Together, we need to work to overcome the division of the world into first-class zones with priority access and the rest with delayed access or no access at all. I will support member states who haven't done so already to establish a digital platform that support real-time collection of data, analysis and reporting, disaggregated to the extent possible to ensure that the men and women both receive the health services on progress made on their national health objectives. And my final priority is to champion One WHO. As Director of Country Strategy and Support, I have led decentralization efforts at WHO because I believe the local decision-making is an untapped strength of the organization. I'm committed to an empowered WHO country office where local decisions are made locally and supported by all levels of WHO. I have supported the Director General to increase the proportion of WHO's financial resources going to countries from 37% to 50%, together with increased human resources. I will improve communication and remove barriers across the 3 levels of the organization to help staff feel free to discuss and share their knowledge as they contribute to shared progress. As well as better work processes, such communication will help WHO's strategic and operational planning to be more coordinated across all levels and ensure the global level can better respond to the needs and priorities of countries. I will work hand in hand with the WHO Director General and articulate the region's voice in regional and global forums such as the G20, ASEAN, and others. There is a leading role we must play in this rising wave of South-South cooperation. And we need to make best use of all partners, including national institutions, regional technical networks, WHO collaborating centers, knowledge hubs to further the health agenda. Finally, office culture is key to thriving and happy colleagues. As regional director, I will cultivate a diverse, gender equitable, strong, fair, and safe bureau and country offices where staff feel empowered, motivated, encouraged to innovate and share ideas across the entire organization. Let me conclude by thanking you again for listening to my vision and strategy in the member states for the Southeast Asia region. I place to you that I will support member states to sustain and build on the progress made thus far and lead Southeast Asia region forward towards a future of well-being for all. I place to be a regional director who is humble, goal-focused, and results-driven. With humble by nature, I'm confident that I'm optimally positioned to be the next regional director for WHO Southeast Asia region. I sincerely hope that you share that confidence and you put your trust in me. In return, I will dedicate myself to all the people of our region as we work together on our common goal of a region whose health and well-being advances every day. And as we power the world to a better, more secure, more prosperous, and fair future. I thank you.
Thank you, Shambhu Prasad Acharya. We will now continue the interview with question and answer. I will now pull the first token with the name of the regional committee members. I shall now give the floor to Maldives. Thank you.
Madam Chair, if you elected as Regional Director of Southeast Asia region, what are the main challenges that you envisage in our region, accounting for 1/4 of world's population in the coming 5 years? If elected as a regional director, what would be the main strategies to overcome these challenges? Thank you.
Thank you, distinguished member, states delegate. Thank you for this question. As I have presented right now, I have seen that major challenges are non-communicable diseases. They're on the rise, and we still have communicable diseases to really finish the final agenda. Like as I mentioned about TB, which is a great concern for the region, since we have close to half of the cases, of global cases are in this region. And I did mention about the plateauing of the maternal and child deaths. The malnutrition, I think malnourishment is one of the second highest in the region. Then, you know, as the mental health is becoming a growing concern, And I think the investment in health, as I mentioned earlier, the primary healthcare is really the basic foundation for achieving the universal health coverage. So no one should be denied just because an individual doesn't have money or lives somewhere else or has certain identity. We need to really build that a lot investment in the primary health. So these are the challenges. But before that, I think I would also like to go back a little further, is that we need to make some efforts first to really make the people healthier. So how do we bring that prevention, promotion, and then part? And I think I did mention earlier about the bringing the social movement, engaging each and every citizen, communities, and the government, whole of government, and whole of society, different sectors, to really ensure that we are doing the right kind of education to remain healthy. So I have outlined this, is that this is going to be my unique kind of strategy, bringing everyone together to make them responsible for good health and also understand exactly what are the consequences. The second is about, I said, the investing in the primary healthcare, investing, increasing the domestic and international finances, but also I think the health workforce. We do have, this region has fairly good health force, but we have a challenge of sending them to the primary healthcare level. So how do we ensure that retention and also the protection part, I think is a big issue that we really need to work on. And for the NCDs prevention, I think there are certain determinants that can contribute to really prevent the NCDs, because these are like risk factors. I think we can address those risk factors from the education part, from the population part. But when the people get that kind of sickness, and it's important that they get primary prevention part, the screening part at the primary healthcare level. I think the primary healthcare should be able to provide the prevention information and also the primary treatment, like the diabetes, glucose measurement, or the hypertension measurement. And these are the kind of things I think we need to be able to expand that in the primary healthcare level. And that's what I would say at the moment. Thank you.
Thank you. I will now draw the next member state. May I now give the floor to Indonesia?
Thank you, Chair. Thank you, Minister Dechen Bongangmo. Again mentioned before by our delegation, the holding of 2 days live forum in which both candidates are coming to be interviewed provide us and wider participants opportunity to assess each candidate's suitability. I thank Mr. Shambu for the presentation. So my question is, could you elaborate more on your strategies to enhance country participation in WHO SHARE and HQ projects or regional and global level projects, and to ensure their alignments with respective national and global priorities? I thank you.
Thank you, Madam Delegates. I think this is a very important and critical question. And I believe that this is exactly one of the kind of mission I have, to really engage more and more our member states in the regional and global committees and advisory committees. I have observed that, often the membership in these advisory committees and then technical committees are often dominated by the Western countries. And I think we need, as I said, that I really believe in equity principles and diversity. I believe in talent is everywhere, but opportunities are not. I want to bring that opportunity to those who are talents in this region and ensure that this region gets the fair share in the participation of our member states in different kind of committees or advisory groups or any other forums in the WHO. And that I will start by starting in the region. I will form many more committees and advisory groups in the regional office, because I believe that the strength that we get in the regional office is by getting rich knowledge and experience that we receive from our member states. So I will basically invite number of our technical experts and public health leaders from the regional office in different committees. I mean, there are so many challenges that we have. We really need to set up committees under each challenge and get advice from our member states in terms of how to move forward to address those challenges in the region. At the same time, there are so many committees at the global level. whether it is about, the vaccines, it's about like pandemic accord. We are so fortunate that Indonesia yourself, Madam Delegates, your country contributed significantly as a co-chair of coming towards the pandemic accord. I think I'm really grateful for that, as I said earlier. So we need to bring more and more our member states engaging in these committees, sharing the lessons, both good and bad, in these committees, so we can enrich our knowledge further to improve our health services and improve our developing our strategies and plans. And this is one area that I have already kind of taken in mind, saying that we will engage more and more our member states in different country participation. And I would like to also highlight at the same time here, diversity is absolutely important. And I will ensure that the regional office will ensure that country participation in these forums will ensure the equity, whether the countries are big or small, whether the countries are at different level stage of development. I want to give equal opportunity to each and every member state because there is talent everywhere. Thank you so much.
Thank you, Shambhu. May I now call the next member state? Thailand, you now have the floor.
Thank you, Chair. We would like to ask the same question in order to be fair for the both candidates. Thailand would like to learn more what and how the candidate will maximize use of WHO Country Cooperation Strategy (CCS) for benefit of the whole region. I emphasize for the whole region, not for individual member states. Thank you.
Thank you, Madam Delegate, for this question. I would say that yes, the WHO country cooperation strategies are very critical for collaboration between WHO and the member states. And these are the medium-term strategies developed together by the member states and WHO to understand what will be the focus of our support, strategic support to a membership country over a period of 4 or 5 years. And certainly, as you rightly said, Madam Delegate, at the country level, because it is easier to follow up and implement because this has been discussed and developed together. So there's some sort of joint ownership at the country level. So how do we really bring that at the regional level is something really a very important question. So my proposal is like this, which I think based on my experience in headquarters, what I had done in headquarters is before the 13th program, general program of work was developed, we try to collectively summarize the priorities that have come out of these 142 country cooperation strategies. And those priorities that were the higher level priorities, we did provide that to our operational and strategic planning department to really say, here are the country, let's say bottom up country focused priorities. I think these priorities need to be taken into consideration when we formulate the global priorities. So I'll apply the same principle here in the regional office. When I become the regional director, I will bring all the priorities from CCS coming out of all 10, 11 countries and summarize them. What are the priorities that our member states have asked for? And that those priorities will form the basis of developing regional priorities. And these regional priorities will be then given priority in terms of resource allocation. Because I like to be the country-focused regional director, and I would like to make sure that, as I've already stated earlier, I will be guided by the member states, and I will bring all priorities that are identified by our member states to be the priorities and not the top-down priorities. And at the same time, I will also advocate for being these priorities informing the global priorities when the global strategic plan is being developed, like the general program of work, what we call. And I will engage our member states, regularly to make sure that when we go to participate at the global level, we make sure that our priorities are well discussed and reflected both in the regional priorities and the global priorities. Thank you very much. Over to you, Chair.
I shall now give the floor to Bangladesh.
Thank you, Chair, for the opportunity. So my question is, in CRO countries, the healthcare system is not equitable. Taking into consideration the political disputes, social disparities, climatic and geographical variations, as RD, how will you ensure equity in the health sector? Thank you.
Thank you, Honorable Minister, for this very.
Shambhu, you now have the floor. Sorry.
I'm sorry, Madam Chair. Thank you, Honorable Minister, for this very important question. First of all, I would like to say that, I worked in WHO for many years, and then right now as a Director of Country Strategy and Support, I have traveled and worked in developing these country strategies, many more countries, and I do understand what you have raised the question about geopolitical issues and the disparity, and then not one-size-fits-all approach. I think this is precisely the reason when we develop our priorities, it has to be tailored into the country context, one. The second is about WHO is a specialized health agency established by the member states based on setting up norms, standards, policy guidance. So we base on science and policy, evidence-based policy. We know that during the COVID-19 pandemic, we were questioning many times, but we did not distance away from our science and evidence. So what we need to do is to really bring what are the appropriate strategies or policies that are relevant to each country. And that's one particular element that we need to really take into account. The second is about going by health is basically an investment in human capital. That's something that each one of us, regardless of whatever political belief we have, we must work for improving health for the entire region. And that is another element that I will look at it. And then the other part is about sharing, collaboration and cooperation among countries. And I think we have learned a lot from the COVID-19 pandemic about the importance of sharing knowledge, sharing technical know-how, sharing the evidence, sharing the results. I think that we can learn from each other to basically advance the health programs and health agenda that will ensure the equity. But one of the things I will also look at is that the regional office will really publish a report on the health progress, and where the inequities are there, we can learn from each other and see how we can address the problem either in a country or in a pocket of area or in a different district or geography. How do we address that? I think the learning is a lot of things to do with, and this can be strengthened further. And the last but not least, I would say is that even if we have a diverse economic and health indices in the region, investment health should not be viewed as health expenditure. I think this is important to really, of course, everyone is aware of it. At the same time, we must continue to advocate for health budget or health expenditure is not expenditure, it is health investment for human capital. So how do we really increase that? It is absolutely essential to bring health equity and investing in primary healthcare, where I said earlier, 90% of the basic health services can be provided at the primary healthcare level. Thank you so much.
Thank you. Thank you. I now shall give the floor to GPR Korea. Shambhu, you now have the floor. Yeah. Oh,
Sorry,
Thank you, Madam
so
Chair.
you haven't received. Oh, sorry. My apologies.
Thank you, Madam
GPR
Chair.
Korea.
Yeah. Question to Dr. Shambhu Acharya. As you mentioned during online forum, building stronger health system for universal health coverage requires comprehensive approach. Those are political commitment, legal framework, effective health financing, resilient health system based on primary health care, infrastructure, health workforces, etc. In this regard, could you please point out one or two most common needs or challenges as a matter of urgency within our region? Thank you.
Well, one urgency, distinguished delegates, thank you so much for this question. One urgency I would see is really the financing part, but as I mentioned in my presentation, this region has the highest out-of-pocket health spending, which really drives many poor people into poverty because of the health care expenditure. We need to find a way to increase investment in health, whether it is domestic financing or whether it is international financing, or from the community, or generating national, local financing. So this is one really critical element I would say we need to work on. The second is about the workforce. Although we have fairly good compared to the other region, the health workforce kind of number and quality. Yet, I think we are still facing some challenges about sending those doctors or nurses or health workers in the primary healthcare level and the remote areas. How do we ensure that? How do you ensure the retention? And then how do you ensure the protection of health workers? Because that's also becoming an issue these days. The one, I think the third element I was speaking would be about engaging the communities and individuals. I think, from my growing up, and then starting my career, and then visiting number of countries, what I have seen over the years is that making people, learning from them first, and then listening to them, and then I think their ideas can really give us a good basis to form our strategies. So the community engagement is extremely important, and then bringing different sectors and actors, because now the health is not just merely the health sector. Health is impacted by many other sectors, and these sectors have to be brought in. If we really improve our health systems, and if we really improve our health services, and also the different care level of care, so the primary care level, or it is district level, or the tertiary care, and this is, in my view, is very, very important. Thank you.
Thank you. We have now exhausted all the questions for Mr. Shambhu, but there is still about 4 minutes time remaining before the 40 minutes allocated for this interview. In accordance with what has been previously agreed, I will now open the floor for any regional committee members that have not yet asked the question and wish to do so now. In this case, please raise your hands in Zoom. Do we see anyone? No? 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 As I see no hands raised and there is still time available, the candidate is invited to make any additional statement they wishes until the end of 40 minutes. Or the 40 minutes ended.
Yes.
Ended.
They ended.
They ended, sorry.
I thought it was 3 minutes.
How much time? Wasn't there 3 minutes left?
3 minutes, yeah.
But now it's 40.
But it's ended.
Did the 40 minutes run?
3 minutes.
There's
3 minutes.
left. Oh, okay. No, bias is showing 40.
3 minutes.
So can I come in, Madam Chair?
Yes, you can for 3 minutes.
Thank you, Madam. I just wanted to a little bit expand on the areas where I have missed in my presentation, of course. There are many critical other health areas which are there in my manifesto, in my website, but I was not able to present because of the time limit. The one that I really specifically see is about the immunization. Immunization is
3 minutes.
Immunization is something that we really need to give a high priority. during the COVID-19 pandemic. Because of the pandemic, there were many health services were disrupted. And I think many countries really reported that their coverage rates were going backward. So the same thing has happened to immunization as well. So the important point now would be already this acceleration process has gone. It is ongoing in the region. But what I would do is there are certain kind of immunization programs which we would need to take a bit more scaling up, and something that I would like to do once I become the regional director. That's one area. The second is about the One Health approach. Of course, I did explain a little bit in a brief, but this is something that's going to be very, very important because of this animal health combination of combine these diseases that are coming, and we need to really build good national capacity for the One Health approach, and then we need to bring One Health approach to address any kind of public health emergencies. And this is again another issue that I would give a priority, because we do have some national action plans, but the resources are not being there. I will do my best to make sure that each and every country will have the resources to boost their capacity. The last but not the least I want to say is about myself, which I made little brief in my presentation. Yes, I do. I have a long experience in WHO. I have an insider. Yet,
May I request Shambhu to wrap it up, please?
I think we have 2 minutes. Is it not? Otherwise, I can wrap it up.
It was reset, sorry.
Okay, thank you. So I want to say a bit myself. I know that I have long worked in the WHO, but I have worked with the World Bank. I've designed the large projects. I've worked at the community level. And in WHO, I have moved up from a smaller technical office to the director of a department, and where I have made significant achievements.
Sorry, Shambhu, I have to cut you off.
Is done?
My apologies. Yes, done.
Thank you, Madam Chair, for your time, and I really appreciate for all the member states for listening to me. And I'm grateful to you all for asking me questions. And I hope I did the justice by answering questions. And it is up to you, member states, to decide what you would like to decide on 1st of November. Thank you so much.
Thank you. This concludes the live forum for the candidates for the WHO Regional Director of Southeast Asia. I would like to thank all the members of the Regional Committee and the candidates for having joined the forum today. We had a rich exchange which will be valuable to the member states in their assessment. Before closing, let me remind you again that the password-protected web forum for question and answers has now closed, but will remain available to the member states in a read-only mode until the closure of the 154th session of the Executive Board. I wish you all a good day and look forward to seeing you in person for the 76th session of the Regional Committee on Monday, 30th of October. Thank you and have a good day ahead. Adjourned.